Good evening and welcome. I'm Sheila Balgobin and I am the Dream Decipherer, and I help you to crack the code of your sleep and dreams so you can sleep sound and dream deep. Tonight, I'm looking at the second part of the series Trauma, the Body, and Sleep. And whereas I've looked at the issue of trauma, in particular PTSD or post traumatic stress disorder, in the past, this time I'll be taking a slightly closer look to and look at the physical impact of trauma on the body. So first of all, how does unprocessed trauma get stored in the body? Well, let's start from the beginning. When all is well, our brain is like the greatest supercomputer on earth. There is nothing that reacts faster than the human brain. And if you don't believe that, let somebody throw something at your face and you react before your brain even engages. The brain is composed of a complex network of some 100 billion neurons. So it's great, not only great at processing information and organizing it, it's also very quick. But every second there's somewhere between 18 and 640 trillion electric pulses zipping through your brain. And this matrix will encode and store memories and experiences which collectively make up who you are. But when a shock disrupts the system, what happens? What is the physical imprint on your body? And and how does it end up lingering in the body and affecting your health for many years to come? It's the truth is that trauma is not just in your head, it's in your body. What one cell knows, every cell knows, because they're all connected with interstitial fluid that keeps them moving around the body. So what if one cell knows something, every cell knows it. So that this imprint of an emotional trauma leaves its imprint on your body as well. So jarring your memory storage systems and changing the way your brain actually functions. So when past trauma is untreated, it can actually have major impact on your health in the future. Emotional and physical reactions can trigger conditions such as heart attacks, stroke, obesity, diabetes, and cancer. And this was according to research done by Harvard Medical School. Trauma is also associated with long term physical problems, and with trauma survivors being 3 times as likely to have problems like irritable bowel syndrome, chronic pain, fibromyalgia, or chronic fatigue syndrome, or CFS. So what exactly is going on in when trauma occurs? Is happening in the body? Well, if you look at it from the brain anticipating a threat, it will react very quickly in order to protect itself from harm. An internal alarm goes off, which is the flight, fight, or freeze response. And that triggers physiological changes throughout the body. For example, certain hormones are released, muscles become tense, the heart rate goes up, breathing becomes more rapid, and your reflexes actually become heightened because of the threat or perceived threat. After this threat or traumatic experience has ended, the body's stress response slowly starts to return to normal. But everybody reacts slightly differently, and all of these reactions would be considered normal and healthy responses to any psychological trauma. Reactions such as confusion, anxiety, physical arousal, difficulty expressing yourself. For the majority of people, these reactions will dissipate with time as the body and mind integrate the experience and um, let it pass through. In other words, and process it and then release it. However, there are people who experience delayed reactions after a traumatic event, and this may include things like depression, fatigue, nightmares, and even the development of sleep disorders. If these symptoms persist over time, or they start to interfere with work, school, or relationships, they may become indicative of a more severe problem like post-traumatic stress disorder. Now, I want to take a look take a little bit more of a look at PTSD, or post-traumatic stress disorder, which is a condition that's characterized by recurrent and involuntary memories of the traumatic event, uh, such as flashbacks, which can happen during the day and can happen during sleep as well and become nightmares. Now, people with this condition may avoid external reminders, such as avoiding people or places or doing certain things, and also try to avoid internal memories or thoughts or feelings that are connected to the trauma. Friends and loved ones may notice mood changes as people become more reactive. They startle more easily, and they become hyper vigilant, always scanning the surroundings for danger. Now, according to research, less than 10% of people exposed to a traumatic event develop PTSD. But in order to be, for people who are suffering with the post-traumatic stress disorder, it's vital that they talk to their doctor or other health professional to learn about what treatment options are available. There are some that are very effective, but it's like horses for courses. Some things will work for some people and may not work for others. But these treatments can help survivors actually heal from the lingering effects of the trauma that they experienced. Now, I'm going to go from there and look at the connection between PTSD, sleep, and the brain. And what researchers have found is that there are multiple overlapping brain regions that are implicated in both PTSD and sleep problems. Most notably in the hippocampus, which is buried deep inside the brain, the amygdala, the anterior cingulate cortex, and the insular cortex, none of which probably will make sense to very many of us, and that's fine. But what these regions are responsible for is to cause the patient to revisit a traumatic event in flashbacks and nightmares, as well as maintaining a state of hyperarousal or hypervigilance, always looking out for danger. These studies have found that individuals with PTSD have a faster heart rate while sleeping, which indicates that they're already in flight or fight or freeze mode. That keeps them hyper alert, so they can't sleep because they're scanning for danger even in their sleep. So it's unsurprising that the hallmarks of sleep in PTSD sufferers include more stage one light sleep. So they're sleeping on the surface, just when you're falling asleep. And they have less restorative slow wave sleep, which occurs at the deeper levels of sleep, in the latter stages of sleep, at deeper levels. And they also suffer with fragmented REM sleep. So they're not dreaming properly either, which is a vital part of the sleep cycle. There's another significant connection between sleep and post traumatic stress disorder. in the way the brain processes fear inducing memories. During a traumatic event, the brain learns to associate a certain stimulus with a negative response, sort of the opposite of Pavlov's dogs, who, when they heard a bell, they started to salivate because they were anticipating getting food. In this case, it's the opposite, that the trigger, whatever it may be, provokes this negative reaction or response. So long after the traumatic event, the association has become so strong that the person suffers a violent reaction whenever they are presented with this particular stimulus, whatever it may be. It may be a song that they hear, or something that they see, or it could be virtually anything, and just sets them off on this loop. Now, normally this response is reduced through something that's called extinction memory, during which the brain gradually learns to dissociate certain stimuli from a learned response. There's a significant amount of emotional memory processing is done during REM sleep when we're dreaming, and researchers are come to believe that REM sleep disruptions seen in PTSD sufferers may indicate an inability to efficiently process trauma. Now, I've made this point before that with people who have been taking drinking or taking drugs for a period of time don't dream. They sleep very heavily. They don't dream because they're suppressing the normal sleep cycle. However, once they start to address those issues and stop the drinking and drugging, the dreams becomes constant and the sleep is highly disturbed because of all the dreaming. All of that stuff that they were suppressing gets offloaded. So there's a couple of things going on here. There's not only that the sleep is disturbed because of the nightmares or repetitive thoughts or whatever it may be, but the sleep pattern is also disturbed, which means that the normal cycle of sleep and dreaming is not taking place, which is only increases the psychological and physiological problems that will occur. Now, this sleep loss may also cause things like daytime sleepiness, and interfere with your ability to cope with whatever's going on, which can leave people feeling anxious and, again, hypersensitive to any trigger. They'll go off like a shot because their nerves are just literally lying on the surface, and anything that can trigger that emotional response will make them go off the deep end. However, having said all of that, the good news is that improving sleep seems to have a corresponding effect on the PTSD symptoms. Ooh, can't talk. So, how can somebody who's suffering with PTSD manage to get some quality sleep? Well, having a good sleep hygiene practice in terms of what you do in terms of before you go to bed, and the conditions around sleeping can actually go a long way towards reducing the symptoms. Simple things that can be done, that is, first of all, to keep a regular bedtime schedule. Again, it's training the brain and creating those neural pathways so that when you start to prepare for bed, the brain knows, okay, it's time to, ratchet it down and start to prepare to unwind and relax to go to sleep. Regular exercise, and that's not only good for our waistlines, but is good for our heads too. It can also help to bring down that hyper arousal, that hypervigilance that's always scanning for danger. Um, I know people are going to hate me when I say it, and I have to say it. Ditch the Wi-Fi. Take it out of your bedroom. Preferably put it two rooms away from your room. And if you can switch them off, even better. But do at least remove them from your sleeping space at least an hour before bedtime. I know it's going to be hard, but it's necessary. The blue light is no good for us because it decreases the production of serotonin and melatonin, which are important sleep hormones. And besides which, the constant pinging is going to keep you up anyway. If you know fear of missing out, leave it to one side. It really will make a difference. If you're sensitive to noise, perhaps a machine that produces white noise, um, or perhaps playing a something on, they have these relaxation tapes and things like that. That may be an option as well. And try things perhaps like meditation or some other or mindfulness techniques in order to be able to get your mind to switch off, so it's not constantly rehashing and rehashing and rehashing things, and possibly stirring up these anxious feelings due to post-traumatic stress. So there you have it. It's that there really is a mind body connection, and what one cell knows, every cell knows. So that if there has been some kind of traumatic experience, it will impact virtually every body system and your ability to sleep. And in part three of the series, we will be looking at trauma that is locked in the body and how it can be addressed through body mind therapies, but therapies that work with the mind in order to impact the body, because we're not headless horsemen walking around without bodies or bodies walking around without heads, though you might wonder about that sometimes. But nevertheless, what one cell knows, every cell knows. So if it's the trauma occurred in the head, it will impact the body. If the trauma occurred in the body, it will impact the mind. And it's important to be aware of that connection and also to heal that connection. And we'll be taking a look at that. And just to give you a heads up, after the third installment of this series, I will be hosting a live with a guest, a special guest. It will be talking about body therapy, and the body mind body connection with regard to sleep and healing trauma. So thanks so much for watching and listening. Have a great evening and start to the week. It's going to be hot this coming week, so find ways to keep nice and cool. Thank you again. Have a great evening, and I'll see you again soon. Take care. Bye bye.